are taking over. Because every Thursday I have to rest because the main host will come.
Yeah.
Thank you very much.
Thank you very much too.
Just that, listeners, this is not politics, I beg you. Yes.
Yeah.
This is about our health.
Yes.
Okay. And it's about cholera. Safeguarding our health, cholera. Okay. Yeah. And Dr. Yamba himself is here. The man himself is here. Yes. So what else? Doc, welcome.
Thank you.
All right.
Okay. Good morning to all our listeners out there. We have faithful listeners who are always with us with Time with Quality Assurance. And this is the last episode of Time with Quality Assurance for this academic year. And it's interesting, and then I'm happy that we are ending with our health, issues relating to our health, which is very, very important, and especially a national concern relating to cholera. And we are happy to have in our midst the Director of Health Services, University of Education, with us, Dr. K. Yamba. We are privileged that he's going to take us through what we need to know about cholera. What are the symptoms that we need to see in case someone is affected with cholera? What are some of the causes and then the steps that we can take to avoid cholera? Doc, you are mostly welcome.
Thank you very much. It's a privilege to be here.
Yeah. So what do we need to know about cholera?
Okay. Good morning to listeners. Good morning to my boss, Professor Mutual, and his team. Good morning to staff of the health services. Good morning to colleague workers of the university, and good morning to EFUTU. Thank you very much. You know, initially we're not built to talk about cholera, even though we're to talk about our mental health, but we cannot talk about our mental health when our physical health is challenged.
Yes.
So there's an acute epidemic of cholera in Ghana, and so we have rightfully repositioned ourselves to talk about that, to bring awareness about that, and to prevent it from escalating any further, especially in our university and in EFUTU in general. Yes, and so cholera is an infectious disease. It causes profuse diarrhea, vomiting, and you may have abdominal pain. And it is caused by a bacteria called Vibrio cholera, and it is dangerous because if unchecked, it can rapidly lead to death. In the last 2 months since the first case was reported at Adan, the cases have escalated. So we now have almost 4 regions now recording cholera, and unfortunately a few deaths arising as a result of that. In EFUTU we have reported cases. We are doing all the efforts to contain it. So it is that troubling. Yeah. So that's cholera by way of introduction.
Okay. So Doc, how can we distinguish between cholera and then you mentioned vomiting and then running?
Yes.
How can we distinguish between that and ordinary, maybe stomach upsets that can cause people to vomit and then also run?
That's fine. So, you know, the diarrhea of cholera is profuse and it is watery. You know, yes, we can all have a diarrhea, but in those instances, we may be able to control our urge to defecate, and so we can contain ourselves before we go to the washroom. In this case, it's not like that. It's just coming and it is watery. You can actually see it as water. If you inspect the stool properly, it just looks like rice water. And typically it has a certain smell. Healthcare workers can tell that this is it, but mostly it's odorless. It's just the water that is supposed to be within the body that is being lost. So you can have that accompanied with vomiting. So you are losing water. The other route from which you can replenish what is being lost, you are also losing. You cannot keep anything in the mouth. So you are vomiting and you are having diarrhea, vomiting and diarrhea. And this is uniquely caused by that particular bacteria I mentioned its name. Yes. The thing is that truthfully, you cannot distinguish just by symptoms. So it needs to be confirmed. And because of its tendency to cause rapid death, that's why we are saying that as soon as these things can happen, we'll take the samples. Even how to confirm that it's cholera is, we send it to a national reference lab for confirmation before we conclude that yes, this is cholera. So all the cases of confirmed cholera cases, they have all been confirmed at the national reference lab. So yes, what can start as a very innocuous stomach upset in quotes, abdominal pain, vomiting, can actually rapidly progress into florid cholera, and it's very life-threatening. Yes.
Okay, so Doc, what should be the alarming rate for a person to quickly rush to the hospital in case somebody? So how many times of stools do you see that you think that is so alarming that you have to rush to the hospital?
Yeah. So let me before we tackle that, let me just reiterate that when the bacteria that causes it is either is ingested, somehow it finds its way into your mouth, either from food, from water, or from infected fomites. Something on the something that you touch and eventually gets to your mouth, and that bacteria would have come from somebody's fecal matter. So you get it from the feces into your mouth, and it takes anywhere between 2 hours to 10 days to manifest if you ingest it. So you might have eaten some food in Accra 10 days ago, and that will be the cause of the current loose stools that would eventually be diagnosed as diarrhea. Because of this confusion, what the health authorities, the Ministry of Health is saying that is that they've come out with what is called a case definition. A case definition is what guides all practitioners across the country on what which symptoms will present, and then you have to proceed to treat as cholera or to suspect cholera and to take the necessary steps. So we have diarrhea, any diarrhea at all. We have what? Vomiting, stomach upset, abdominal pain, stomach pain. When you have these three in any person who is more than 2 years old, yes, we would suspect diarrhea, cholera, until proven otherwise. And so in health facilities, if you go there and you have vomited even once, and malaria too does this.
Yes.
Some other things do that.
Yeah.
But at the health facility, we are able to safely tell the difference and know which of them we are taking the samples for, which of them we are not treating as suspected cholera. So those three are cardinal for diagnosing cholera. Cholera attacks one of our most vulnerable systems. You see, the body is composed of nearly 70% water in adults. For children, it's even higher. Now, that is what cholera attacks. It attacks the water composition of the body. And so you can have it rapidly declining from this 70% to 30 or 40%. And when that happens, your tissues will now start having troubles with keeping up. And that is how come it can rapidly result in death. So any diarrhea, any vomiting, report.
quickly we have to report. Yes, and you know, you can't cholera wasem ewo sesiara imbra nyuma yedzen and yarishe cholera wasem inti ne yepede yehu de eba na azenye cholera vomiting ana ejana ye jadada na oye cholera na de oye ibanaze. And see, that is what doctor is trying to explain to us. Dr. Ocheche Hinimu, Nyama, or the cholera, or the ban, 10 or try there, yet to one a mon call hospital, so that ye tumina ye at Nasacher. And see, cholera was some Yerka. Ma Dr. Ocheche Himu de cholera yada, Abuobia, or the Okohinin Pediema, or the Yaroba ozebra hen na Yaroba ota zebra hen nyame baasa no gyina do de yebefe yebokodo ya afe bebre ana ebeja wonan bebre ana de wiyem beye weyaw nti se ihu de menzame yara ntantantantantam o de wana mon yetia ewo hospital na wetum wa hwede o ye cholera ana don ye cholera ama etum na enya honten nti ono no ho asam na na pay yegudo a yereka yereshe. Thank you, Doc. You mentioned about 3 causes of getting cholera. Some ones fecal matter and water and food. Is that the only causes of cholera, or there are other causes that we also have to be cautious of?
Okay, so those are the routes of transmission. Cholera is such that there are people who may have it and won't show any symptoms. It is found in their fecal matter. So they might go to the washroom, and then as they use the washroom, they infect the surface. They are not symptomatic. They don't have diarrhea. They don't have vomiting. Now, when you go there to also ease yourself or use the facility there, and you touch the surfaces, you pick those, germs in your hands, and in the course of your activities, you put it in the mouth. You will indirectly inoculate that into your mouth, and then it starts the cycle again. It goes into your stomach, causes the troubles, and pass out through the feces again. So that is the indirect route. But directly, it can also be found in food. So people go to defecate somewhere, flies will pick it, go and settle on food. You pick that food, you don't prepare it well, and then you ingest it, you get it. Water, either directly or indirectly, you can also get it through that. Those are the only ways you can get cholera. You cannot get cholera from blood transfusion. You cannot get cholera from mosquito bite. You cannot get cholera from the air. No, it's directly inoculated or indirectly through the other formats that I have mentioned. So yes, that's how we get it into our system, no other way. So once you have cholera, it means, and somebody said, you have eaten somebody's feces, and that is the truth. That is the truth.
Yeah, so it sounds dangerous and then interesting as well. So people are just, how do I put it, inoculating areas that we move about with. We board cars. We sit at places, we go to restaurants, we move along everywhere, and we have been touching even people. We touch here and there. I remember when COVID came, we realized that we are so cautious about how we keep ourselves, but then COVID is gone. We know it's all hanging somewhere.
Slacking somewhere.
Yes, but still, humans are humans. And so we've forgotten about ourselves. What are the steps? What do we do in times like this, which this pandemic is very alarming to all of us, especially with children and then adults? we can begin with children who are so vulnerable. What precautions can we give to our children to protect them? They are always in school. They are playing all over on the field. Currently, I think they are having sports, and they are out there doing all kinds of things. What can we do to safeguard the children? And then we now come to elderly. How can we sustain ourselves well to maintain good health, healthy environments, and then keeping ourselves so that we can also continue to live and work for our mother Ghana?
Yes, thank you very much. Children are a very vulnerable group in terms of their immunity generally, but they are also I wouldn't use the word difficult, but it is challenging to address and to let them understand that they have to do certain things differently. So that responsibility is transmitted to the caregivers, parents, teachers. So what we generally advocate is that in schools where children gather, where there is mass gathering, so their sanitation facilities, there is another level. I mean, just step it up a bit, so that there are so many people coming using that facility. If you used to clean it maybe once a day, it is time to clean it every 2 hours. Yes, it's more work.
Yes.
But those are the only ways. You cannot tell a 2-year-old that you have to. They don't even understand the concept. So it behoves on us that wherever they use, let's make it clean for the next person to come and use. And the earliest sign of ill health relating to cholera, let's remove that person from that cohort. So children with diarrhea and vomiting, this is not even the time for parents to send them to school. When you have diarrhea and vomiting, send the person to the hospital. If the teacher identifies a child with diarrhea and vomiting, it is time to institute their emergency sick protocol. Either they are sending the child to the hospital and calling the parents, or they are calling the parents to come and take the child and send to the hospital. As soon as you do that, you take away that agent from the immediate environment of the child. Also, this is not a time for us to do normal cleaning. This is a time for us to disinfect our washroom areas with a little bit of chlorine here and there. Disinfects every place, such that even in the unlikely event that somebody goes there, spills it around, somebody has come to clear it up. And also for the young ones, let's teach them. Yesterday my kid was 3-year-old. He was singing how to wash his hands. I'm sure the teacher taught them. So let's teach them how to do that. They will try to do it. Let's help them to do it. As soon as they go to the toilet, let's wash their hands. When they come out, let's wash their hands. And let's report sick children quickly, so that they take them out of the environment and then take good care of them, and then make the environment safe for other persons. There are other things we can do, but as a country, we've not gotten there. We are not giving cholera vaccines. There are vaccines that can be given, but we don't have. The national response has not gotten to the level that we are giving cholera vaccines to children. And so, yes, and this is the time that children should eat properly. This is the time to boost their immunity. Most of the cases that may arise could be taken care of by the body. So you have people not reporting symptoms. There are other people who don't report symptoms, but they are sick. We call that the subclinical person. They still have it and they are transmitting it. But if the immunity is enhanced, they can clear it from the system. And then there are the sick people, those people who are sick and transmitting it. And obviously those who are, very, very, very ill and transmitting it to other people. So for children, that's the thing to do about them. Regarding adults, it's much, 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 much easier. You mentioned COVID. Our hand washing protocols help us Remember we said that when you go into a washroom facility, or not even a washroom facility. Let me give you an example. The first case of cholera that was reported in a Futu, the person came in a taxi.
Wow.
So we those who take taxis,
Yes.
you can just go and sit in that taxi, somehow make a mistake, pick your water, turn it. The rim of your water is going to your mouth, and then that is cholera, and you will not know how you got it.
Yes.
So hand washing is key. We are advocating for us to go back to our hand washing protocols that were instituted at the time of COVID. It helps very much in preventing person-to-person spread and breaking the chain of transmission for us to contain this and move on. Also, because it's food and water, we should be particularly careful about our food and water. The profile of the first cases we had in the Futu municipality, there were people who were selling food. There was a cocoa seller there. And so I'm not spoiling cocoa seller business, but you can imagine the number of persons who are at risk just because of what she does. So generally we say cook your own food, but we know that the economy and how things go, people cannot do that. Eat from now. This is not a time to go and eat from a gutter. A gutter already has the fuel to easily pick the infection and give it to another person. Eat from a decent place. Eat hot food. Drink clean water. Where you are not sure about the source, we say you should boil it, cool it down, and then you can use it as drinking water. We know that cholera is a disease of development. It's actually not a medical, in terms of the causes, it's not a medical disease. It's a disease that is caused by poor access to water, sanitation, and hygiene facilities. So you see that you will see our neighbors in Wutu Senya East, where they are doing the road there, and there's a refugee camp there. They are reporting a lot more cases. So it just tells us that there's a little problem with access to water there. So where you don't have a toilet, people do open defecation. That is not the thing now. When you should try to dig a hole and put it there if you don't have a toilet. If you have a toilet, use it nicely, make it clean, such that no person who goes after you is at risk, or you don't go and pick it from another person who has gone there. Yes, and so these are the things you do in terms of prevention. Of course, those are direct things. Indirectly, this education, awareness, community engagement, there are ways to raise the alertness of people to the fact that there's a danger around, and the fact that they have to take caution not to get infected. So yes, that's the short answer to your very long question.
Interesting. Yes. So we are still with time with quality assurance, and then we are treating cholera. Things we need to know about cholera, what we have to avoid, and then keep healthy. We want our listeners also to understand that this is a serious case that we need to take seriously, and for us to maintain good health. And Doc, we want you to, before we go to the other questions, all the short explanation you gave, if you can explain it with the local language as well, so we can understand well.
My lawyer has built out. Cholera, disease, from filthy food that comes from feces is what.
Ejanai.
So when you cholera, I know you say what the obi ejanai.
Okay.
So your baby, your person boy a home buyer.
Yeah.
Say bibia ebe say obi kwa jaino naya then yebi for akola eye din kakra because omuko school omon tiasi cholera omon tiasi. So sa responsibility no fall on teachers ne parents. So omo jana facilities are say see there enye normal one day cleaning no.
Okay.
Yeah short time every 3 hours na yakwa paper every na yakwa paper so that obi ko hokra na ojai we infection around na ye ba ye paper and sa paper no enye normal paper ye the chlorine ni parazone na ya dia paper kama so that even oye na ewo ho our paper. And so the enhanced cleaning protocol no ese yenye wo school etosu mienu akola yarea ofi ana oko toilet sata that is the time that you be free ni parents na ba be fa no ko hospital ana yem fa no ko hospital so that disease no and what's our environment no so that akola bi sa ba be fa omo eating facilities na yemma omo duane na ye she. And let's take our time between feeding one child to the other. Let's say between cleaning one child and attending to another, let's say yenim say says din but mre na ewo no enye ordinary mre. Cholera ebetimi akun within 2 hours from onset of symptoms you can become a dead body. And so yenim say din but yes here ebebuan ye adults no no eye easy kakra because ye tiase say wo ko ajanaya na wa ho nsa sa covid time no mo ye ba na say o ho nsa ni sanitizer eboa papa say the ebe breaki chain of transmission no me ka say first case yenye wo efutu ha or the taxi that free baby no buy me say sa taxi no unim say wa wo kwa akotena ho ana mi kwa akotena ho ana but if otena ho a na me catch me say cholera no a profuse diarrhea you can't control it so sit no ebe wom ukwa akotena sia na odi usa asum na ubabe numunsio wi a na odi usa bie wonsa no a touch mouth no na odi a show anyo o say o shall see rano si o wo ndi eduanu be bia you have taken cholera so ye huhu ye nsa ye sanitize ye ho a ebe kati chain of transmission cholera no enye even medical disease a disease of poor access to drinking water, sanitation facilities and hygiene facilities. Only sa we know it increases your risk. That is why it is not any surprising to say uko kaswa na cases no omo was kakra. It's not surprising because omo ye kwan wo ho refugee camp wo ho population no dorso so ni nyina they work together in favor of cholera against us. So but in Efutu fortunately we are not like that. We don't have such demographics around us, so we can easily break the transmission. Say we cry any toilet cry me ko bicha na me hwe say nipa no mo da ho mo they are doing their own thing. Yeah. That is not the right thing to do. Ukwa emfa who is what? Aso na ya tu
etutu form na ya kataso.
Yes, na kataso. Na nyina na anyen. Yes sir. Fly
once ma
enko ho na mba ba bed sisi wodiane na wadi na wanya cholera.
I'm also ready so major. Because we can't pronounce public toilet.
What's that?
Even one for your way. My new one. Bakum separate. Me many doctor been examined latte.
Yeah.
Every program is you. Also, who project and I'm sure young cock me one Saturday in break. You could do a nipper that's a new project for Friday. Public toilet, BBA.
Who said,
I was saying to me, you know, if you say, I won't take us on TMO so no, okay, Futu. It be my time, Nandy, the Chinese Massa, and Ponano one I mean, what in I go school. Then started Casana and then, or Shana Tadi. Kafra, I took around one baby. How come you can miss Missano?
Now, or foot taxi, now so for taxi. So I know once behavioral change is difficult.
Yeah.
And easy.
Very difficult. And community engagement, says here it has to be enhanced.
Yeah.
Sometimes we think that this is what the people need. The people don't think the same way we think. So community engagement young I'm sure with time behavior will change. Where a barber you law enforcement. The public health emergency response team in Efutu. Police were whole. Fire service were whole. BNI omo were so a cock do baby yen pese yen do ho ye pese yan kasa yen who say
we ni they are we
otiase na wasesa osuban na ya avoid the problems. So yes, we have to educate, engage. Maybe there is some other problem, that is why they are not using it. And if you are able to understand it from their perspective, now you are solving it. Then
the 1993 until 1999, we took quite sense of back. Almost say I'm from a form of 20 chain. But a closer to know. Obviously, cutting out the closer to assume to me, Jan and I, because I say, BB attitude, we are restricting or new way. But how can you think like that?
No. Yes, sir. We have to adapt our technology to their needs.
Yes.
If you don't do that, and we say that this is new technology, you have to use it. That is what we have at our hands.
Doc, me no. I don't for be school.
And yes, behavioral change.
When you so be took a few roman school. I bet see a case and queen say chilo, a bush.
One
this son says so only a general fear. What the name a younger officer so Debbie cry. What?
So you see, the influences of human behavior are complex.
Yes.
They are complex. We want to try to appeal to homo conscience. Where it fails, then we now use
apply force.
But for now, is trying to appeal. I mean, when COVID came, they restricted our movements.
Yes.
You couldn't just get up and do anything you wanted.
Yeah.
So, fortunately, cholera no end. We are praying that people would listen to the message. Now, behavioral change that is needed in terms of hygiene practice, no change. A difficult that is where I would urge my colleagues in public health. This is a very good area for research. Go and do some research. Let's look at the factors and the proper solutions. I'm sure at the right table, action can be taken, and then we help the people generally. So I don't make for adults, yes, now you break a chain of transmission now. Yeah. But generally, cholera no is because we have eaten another person's agent.
Yeah.
So that's the summary.
Yeah. Dr. Waya, dear Papa, yeah, that's it.
No, one place a time in some because they're just in no struggle now. Into what you're 11, I'm ever for news.
And you know, you go there, you can't cholera wasam. Then Dr. Wachechi Macha Henan, which are there, Yedi and Huni. Na yesha de yebonum super. Ye to me good hygiene. You keep proper hygiene. We are still with time with quality assurance. We have, if you have a question, epede bisa anade into dubi bibi antiasia epede imeyatiasia. The number is 050 392 3158 050 392 3158. You can call on this number or you can send us a WhatsApp. Into biara opede obisa question biaran number nenye 050 392 3158. Able to send you WhatsApp, able to send you an SMS, and able to so afre wo kasa nkoma yerizi e wo cholera home there able to na yesesi ye no home. Thank you very much, Doc, for this wonderful explanation. And so we want to find out, you've told us about hand washing, enhancing our protocols, and then also continuously sanitizing. So I think that at this point in time, the protocols that we started with the cholera is also key at this crucial time that we need to avoid cholera in our lives. And you mentioned two things that I want us to see if you can recommend, apart from other recommendations that you would give to us before we wrap up for today. Community engagement and attitude towards keeping hygiene and then sanitation. That is one. And then that of our schools, keeping school engagement. Do we always have to wait till we get pandemic that we always have to go and then engage? You mentioned the public health. This is a good research. Fine. For me, I think that sometimes we always sit down aloof for us to for the pandemic to come before we educate. But then, what are the steps that our public health can take as far as our health is concerned, environmental issues are concerned, so that there would be regular, continuous engagement with our schools and then the community, so we keep healthy about some of these things?
Yes. Before I address this, I would like to urge people that cholera, the treatment is free. At all levels, it is free.
Oh, okay.
Nobody should look at cost as a barrier to seeking help when it comes to cholera. Once you're having vomiting, you're having diarrhea. Once you go there, treatment is free.
That's a good news.
Yes. And so that shouldn't be a barrier. And there is no first aid in cholera. We don't have first aid. The first aid is going to the hospital.
Okay.
Let the assessment be done by the health team, and then they can say that, okay, for you, please go home. For you, we are keeping you here. For you, we are giving you IV fluids. For you, we are sending you to the district treatment center. We make mistakes in this, and it has been costly in certain settings. I have said that cholera can kill you within 2 hours. You can wake up 7 a.m., you are fine. You have gone to bath, take your bath. You have done edit. You've gotten to the office at 8 a.m. the next time by 10 a.m. you can be in the morgue because of cholera. So it's not a time to take water and say, oh, wait there, be cold. Once you have diarrhea and vomiting, please report. We'll do the necessary assessments, and then we will treat you. It is not. I'm not talking about the University Health Services. This is across Ghana. All the health facilities in Winneba, in Efutu, and all of them have been sensitized on what to do when somebody presents with these symptoms. So don't see that this is a CHIPS compound. I won't go there. I want to go to the university hospital. Before you get there, something might have happened. You go to a CHIPS compound. We have a platform. We are all on it. And so if there's a need for me to leave the studio and go to Atechedo or some to go and help in managing a case, we do. It is not the time for segregated healthcare. It's a time for integrated healthcare. It's a time for collaboration.
Good.
So we speak to our sister facilities. The last time the regional team came to our facility in the university, traditionally we are not a Ghana Health Service facility, but because of collaboration, we are working together. So the closest health facility, the nearest health facility, when you have symptoms, report, and it is supposed to be free of charge. Yes, and so in terms of cholera, we've actually been, the public health system has been working. We use our community health nurses that go to the community to engage them in other areas, traditionally the child health services, but they also put an ear on the ground and listen for problems. So that is a passive surveillance. We also do active case searches in so we traditionally every month we look at our data, see the number of cases of diarrhea we are having. If it is getting out of hand, then we pause, look at the data again, look at the demographics, look at the individuals, and then we'll do the analysis to see. Quality assurance has shown us that it is health is important in everything.
Yes.
So as far back as January, we had a health hour in November. That is forthrightness, and I pray most of the departments do that. We are ready. We are open to collaboration to enhance the health of the populace. And so health is something that can bring education to a halt. COVID showed us an example.
Yes.
I'm praying that cholera doesn't do that.
It won't.
And so let's do the necessary engagements. Let's, we had challenges even accessing some of the schools, but now because it's now becoming a thing of the past, because you go to school, you have to do school health education, you have to give them immunizations, you have to give them supplements. This in the past we had challenges, but because of the continuous engagement we are having, it is becoming better and better. The community engagements we mentioned, yes. The other agencies in health, environmental health, sanitation, water, we are having close discussions. For instance, sometimes you trace all this and you go and you find out that it is one particular borehole or one particular water reservoir that is a problem. And once you solve that problem from there, the problem is solved. Good. So community engagement is very important. It is cholera is one of the diseases that you have to have close collaboration between clinical health, public health, and the community.
Okay.
If you do them in isolation, you will never get it right. You have to do them together, and all of them have to gel up for you to contain the situation.
Thank you very much. Are there any other recommendations apart from community engagement, school engagement, that we need to know about cholera?
Yes. As I said, in terms of clinical care, report early. It is treatment is free. Okay. Let's get back to our COVID protocols. Sanitize our hands. Do not hesitate at all to contact any health facility when the symptoms arise. Yes, so generally that's what to do to prevent people from dying from this very preventable disease. The other actions that will help cholera are in the other sectors. So the community engagement would make other actors to sit up, and then we have less cases reporting for treatment at the hospital.
Thank you very much. Enyanum yada sibebre yegudu za oye menije kese wo cholera sama yere kan de oye free wonje sika bia wom obia ko baby eboko bia hospital kese o hospital kakrabo baby wo bia treatment of cholera is free na over there yenso ye report ntam ihu de refe ana wiye bi ya wan tentem na report ewo hospital won ju sika mandwini sika ezibokwa aka ye wo hu edru o sande wo bo show free a worin je wo hwe na yembo mbozene de ye bokodo ara na ya wohoro ye nsa ya sanitize ye nsa o sande baby a ezewon sarko so inyim de obi ewo covid ewo cholera another onye cholera. And so that is how we have to protect ourselves from getting cholera. Treatment is free. We have to go back to enhanced protocols and then report as early as possible because our health matter. We need to ensure that we have quality life. Then we can continue to live in quality as well. So this is time with quality assurance. We open the lines for calls and then comments 0503923158, and then we wrap up with time with quality assurance on the topic safeguarding our health, cholera.
This is Radio Windy Bay 98.3 FM.
Session, we have talked about cholera, and then we said cholera, we get cholera from someone's fecal matter, from touching infected places, from infected foods, from poor water, from poor hygiene environments, and keeping poor sanitation. And so if we have to be safe from cholera, we need to have these precautions. We always have to drink good water, potable water. We have to keep proper hygiene and continuously make sure that we wash our hands and then keep our enhanced protocols by also regularly sanitizing our hands. Report early. This is the recommendation as far as when somebody starts vomiting or running. Report as early as possible to every health center that is closer to you, and then make sure that you go to be treated as early as possible, for treatment is free. And so, Doc, we are so grateful to you for this education. We need to educate, we need to continuously make sure that our health matter. What's last thing would you want to share with us as far as cholera is concerned?
I think you have nicely summarized everything we need to know.
Yeah.
I wouldn't dilute it. I'll just urge people that take good care of themselves, eat healthy now, more than ever, drink healthy water. If you have any challenges, report, we'll sort them out.
Thank you very much. This is the last episode with Time with Quality Assurance with this academic year. We want to see you next academic year with another edition of Time with Quality Assurance. Thank you very much for listening to us.
Thank you very much, Madam Professor Emma S. Eshan, yes, and then Dr. John Kairi Yamba, Director of University Health Services. We are extremely grateful for that wonderful presentation. I say next year you be a morning show now, Mona be host.